My name is Tony, and I have severe hemophilia B. Growing up with hemophilia B wasn't always the easiest. I did have a lot of challenges. My target joint and my ankle developed pretty early on. There was a lot that I wasn't able to do, and growing up I was on and off crutches. With all the challenges growing up with my ankle, it wasn't fun having to think about when is my next surgery going to happen and what is that next surgery going to be. It didn't feel like I got dealt the best hand. I saw myself as not being as strong as everybody else just because a small injury could be a big injury for me. Later in life, I started seeing it as, oh, you're not fragile, you're tough. You deal with all this pain, you grew up with all this pain, and you've really stuck through it, and you've never made it a big part of your life, which is a lot more strong than it is fragile. In my family, we were always taught that knowledge is power. We were always encouraged to ask questions of the doctors, to learn about our own diagnosis, really find out as much as we can about different treatment options and our own hemophilia. Me and my hematologist are fairly close. He knows how big of a nerd I am for science and how I love reading and watching the clinical trials as they develop. So I first heard about IDELVION actually on clinicaltrials.gov. When I first read the report about IDELVION, I was still on a short-acting factor, and having a long-acting factor sounded perfect for my lifestyle. As I look back on my treatment history and the products I've tried, I spent 18 years on one short-acting factor, and I spent another year on a long-term factor, and it worked, but it didn't protect me to the level that I wanted. So switching to IDELVION was a no-brainer for me. When we got closer to IDELVION being approved, my hematologist was really excited about it. We both thought it was a good fit and that it would really help cut down on the number of infusions. Switching to IDELVION meant the dosing schedule I wanted, it meant the protection I wanted, and I haven't had a breakthrough bleed since I've started. A big part of my life is my dog Tilly. She's a lab collie mix that I've had for the last 4.5 years. Some of my favorite things to do with Tilly are go to the dog beach, hang out, go hiking. One of the most frustrating things about my ankle being out of shape was the fact that I couldn't do those things. So I really knew it was time to do something about that, and that something was have ankle replacement surgery. Being so young and having to have an ankle replacement surgery was fairly unheard of. A lot of doctors said no, that they wouldn't operate on me because I was so young or because of the hemophilia. I was really nervous going into the surgery just because there was so much that could go wrong with it, and the hemophilia always tends to complicate a little bit. Before having my surgery, me and my hematologist had planned what my dosing schedule would look like on IDELVION. I dosed one time before the surgery, and then every couple of days I had another dose after the surgery. It really worked out great because this is a surgery that has a ton of swelling related to it, and I really didn't have much. We had originally planned out a 36-week recovery period, and I was able to accomplish all of that in 16 weeks. And I think a large part of that is the fact that I've made sure to keep up with my dosing regimen and stay on my prophylactic treatment. That's really helped me not miss a day of physical therapy. Compared to the other surgeries I've had on my ankle, this one was definitely the hardest, but it's the only one that's given me this much relief and really been able to change my activity level. Now I'm able to walk my dog just around the city. I'm allowed to go hiking. I'm allowed to start playing volleyball again. Just being able to do those without having to sit there and stop for a break or think about how much pain I'm in. The biggest change in my life since starting IDELVION may not seem like a big one. I just don't think about my hemophilia as often. It's not at the forefront of my mind, and it's not something I worry about every day. It gives me the feeling that I am covered, I am protected, I am all right to do the activities that I want to do. Having that protection and that peace of mind has been everything to me.
Important safety information. IDELVION, Coagulation Factor IX Recombinant, Albumin Fusion Protein, rFIX-FP, is used to control and prevent bleeding episodes in children and adults with hemophilia B. Your doctor might also give you IDELVION before surgical procedures. IDELVION can reduce the number of bleeding episodes when used regularly as prophylaxis. IDELVION is administered by intravenous injection into the bloodstream and can be self-administered or administered by a caregiver. Do not inject IDELVION without training and approval from your healthcare provider or hemophilia treatment center. Tell your healthcare provider of any medical condition you might have, including allergies and pregnancy, as well as all medications you are taking. Do not use IDELVION if you know you are allergic to any of its ingredients, including hamster proteins. Tell your doctor if you previously had an allergic reaction to any Factor IX product. Stop treatment and immediately contact your healthcare provider if you see signs of an allergic reaction, including a rash or hives, itching, tightness of chest or throat, difficulty breathing, lightheadedness, dizziness, nausea, or a decrease in blood pressure. Your body can make antibodies, called inhibitors, against Factor IX, which could stop IDELVION from working properly. You might need to be tested for inhibitors from time to time. IDELVION might also increase the risk of abnormal blood clots in your body, especially if you have risk factors. Call your healthcare provider if you have chest pain, difficulty breathing, or leg tenderness or swelling. The most common side effects of IDELVION are headache and dizziness. These are not the only side effects possible. Tell your healthcare provider about any side effect that you experience and contact provider immediately if bleeding does not stop after taking IDELVION. Please see full prescribing information for IDELVION, including patient product information. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also report side effects to CSL Behring's Pharmacovigilance Department at 1-866-915-6958.